Today, we'll look at China's healthcare system and recent research developments in the context of a rapidly transforming multipolar world where new models of development, healthcare, and political governance are showing their strengths. We'll discuss this and more on this week's China Report. Welcome to the China Report, made in collaboration with Pivot to Peace. Every week, we will be helping you sort through all the propaganda with an independent view of the country we are told to hate, but know so little about. I'm KJ Noh. These are this week's headlines. Taiwan secessionists worried after Trump's dressing down of Zelensky. Secession-minded politicians on Taiwan Island have been reeling after Vladimir Zelensky's meeting with President Trump in the Oval Office turned into a public beatdown and defenestration, disposal in the Oval. The choreographed ritual intended to conclude with Zelensky signing over half of Ukraine's mineral rights fell apart when Zelensky challenged Vice President Vance on the value of diplomacy with Russia. This led to the vice president accusing Zelensky of being an ingrate, and President Trump charging that Zelensky had no cards to play and that he was gambling with World War III. President Trump later stated that Zelensky disrespected the United States of America and that America will not put up with this. On Taiwan Island, U.S. allied secessionist politicians who had been in favor of replicating Taiwan as the next Ukraine against China were chastened by this spectacle. The Trump administration has blown hot and cold on Taiwan, accusing it of stealing U.S. technology and stating it had to pay protection. According to NPR, a former Taiwanese lawmaker stated, "It's difficult to guarantee Trump's scolding of Zelensky today won't happen to Taiwan as well." Another Taiwan resident said, "Taiwanese people should think about what we can provide to the Americans so they can offer us more help instead of selling us out." South Korea celebrates its 106th anniversary of the March 1st movement. Tens of thousands of Koreans thronged the streets in Korea and in Korean communities around the world on March 1st to celebrate Korea's assertion of sovereignty 106 years ago against Japanese colonial rule. This was the first and largest non-violent mass protest movement of the modern era. 3 million Koreans, over 10% of the population, turned out on March 1st, 1919 to protest. The movement was extinguished through mass slaughter. Japanese police killed over 7,500 people to suppress the movement. Surviving activists went to China, where they created one of the modern world's first governments in exile, the Korean Provisional Government in Shanghai, in April of that year. Other survivors went to Jilin, northern China, where they took up arms and engaged in guerrilla warfare against the Japanese, eventually joining hands with the People's Liberation Army and serving a critical role in defeating the Japanese to liberate China. 1 year later, in 1950, China returned the favor by sending 3 million volunteer troops and workers to defend Korea against U.S. aggression and fighting the U.S. to a standstill. After a truce was signed, Chinese troops promptly left Korea as stipulated in the armistice. U.S. troops refused to leave and are still on Korean soil. ASPI suspends anti-China research as U.S. funding for disinformation is cut. ASPI, the Australian Strategic Policy Institute, a government think tank that has been a major propagator of anti-China disinformation and threat-mongering, has suspended its so-called research on China due to funding cuts to USAID from which it was receiving money. According to the Citizens Party, Australian Citizens Party, ASPI is the principal source of the deliberate disinformation that has achieved a breakdown in diplomatic relations and which is pushing the world to the brink of war. ASPI was responsible for manufacturing lies about Uyghur imprisonment in Xinjiang, labeling satellite images of ordinary schools, apartments, and factories as concentration camps, and boosting lies about Uyghur genocide and Uyghur enslavement. Legal scholar Jack James stated the ASPI report, Uyghurs for Sale, was a piece of strategic disinformation to exact harm. Still, ASPI appended a disclaimer to its work stating no person should rely on the contents of this publication without first obtaining advice from a qualified professional. ASPI also criticized people challenging their lies as paid agents of China while actually being funded by the US government and weapons manufacturers. China's Unitree Robotics open sources its technology for humanoid robots. Unitree Robotics, a Hangzhou-based Chinese robotics manufacturer, famous now for its robot dogs and its dancing and fighting humanoid robots, has open sourced its cutting edge algorithms and hardware designs for its latest G1 robot. Industry specialists have lauded its collaborative ethos and compared it to DeepSeek AI, another industry transforming firm that has open sourced its technology for anyone to use. China's healthcare system has recently come to public consciousness in the West, with TikTok refugees on Red Note comparing healthcare in the US with that of China. At the same time, Chinese medical advances in treating Alzheimer's, diabetes, Parkinson's, and cancer have taken the medical world by storm and are transforming the landscape of treatment. In today's China Report, we will explore the political economy of healthcare under China's public health system and contrast it with that of the US's privatized system. To discuss this, we are delighted to have Dr. Margaret Flowers and Mimi Zhu join us. Dr. Flowers is a pediatrician, longtime public healthcare activist, and the editor of Popular Resistance. Mimi Zhu is an author, artist, influencer currently living in China, and the author of Be Not Afraid of Love. Welcome, Dr. Flowers. Welcome, Mimi.
Thank you for inviting me.
Thank you so much.
Mimi, you are currently living in China, and you have had some experience with the Chinese medical system. Can you start by telling us a little bit about your experiences with the Chinese medical system?
I'd love to. This is one of my favorite questions because it also completely astounded me how incredible my experience was here. So I've been living in Shanghai for the past few months, and I'm very lucky to not have any physical ailments, but I still really wanted to see what a Chinese hospital was like. So I went to a Chinese hospital one day. And I think with a country of over 1.4 billion people, it's really difficult to even visualize or think about what the medical care system could look like, right? But I went to see it for myself, and I went to a hospital that my friend Zoe recommended I go to. We went together, and immediately as I walked in, everything was provided by automation. Like there were vending machines, there were all these screens that showed you all these directions of how to get a ticket, how to get in line, and it was so efficient and so fast. So I was already very, very impressed by that. And then I get into the building. And first of all, it's not just a building, it's like a small village of buildings of different departments. And this is a public hospital. So there's about 7 or 8 buildings just there. There's a canteen for the workers. It's just like, I don't even know where to go. But I go to the biggest building I see, and it's about 8 stories high. So we're inside, and every single floor has a different section for different kind of ailments or different kind of treatments that you'd want. It can range from, stomach issues to abortion to back pains, like all kinds of things, very specific things. And the way the efficiency works in the Chinese healthcare system as well is that it really allows you to get quite detailed on what the treatment is, and you can find the specialist because the specialists and the care are there. They have some of the best specialists and doctors, especially in public hospitals. Actually, I think the better doctors are usually in the public hospitals and in the state-funded hospitals. And so I also made a video about this experience that I'd love to show you. Hey guys, come with me and Zoe for a day visit to a public Chinese hospital. As soon as we arrived, I felt like I was in a mini city. There were so many buildings for different medical departments, and the special thing about this hospital is that it combines Western and traditional Chinese medicine in their research. We made an appointment, which you can do very easily on your phone or at electronic booths. There's so much information about doctors and their specialties, so you can find a doctor suited to your specific needs. You don't need to have a Chinese passport to be seen, and I got a hospital card super quick and easy. As you can see, the building we chose is huge, with 6 floors of different areas of treatment. You can rent wheelchairs for free just by scanning a QR code, and this is the gynecology area, where there was a vending machine with free contraceptives. The waiting areas are so clean and comfortable, and I chose to see a doctor regarding my anxiety, and only had to wait around 10 minutes to be seen by her. She was thorough, asked plenty of questions about my lifestyle and emotions, and prescribed me TCM to regulate my stress levels. An appointment cost 21 yuan, which is about $3. Listed clearly are the prices of certain treatments, including traditional Chinese massages, acupuncture, herbal baths, and more.
So in China, to get a urine test, urine test, 10 fucking RMB, $1.5.
You can pick up your medicine at the prescription counter, but I opted for mine to be delivered right to my door. All the ingredients were cooked into a soup, and in total it cost $45. Overall, an incredible experience at a public hospital and an insight into the healthcare system and what is available to the people here.
Well, that is very impressive, Mimi. And I hope you're feeling better.
Absolutely, in many ways.
I wanted to turn to Dr. Margaret Flowers. Margaret, Mimi was talking about emergency service and ambulances. I was with some friends at a gathering a little while ago, and one of our group felt a little bit dizzy, and out of an overabundance of caution, we called an ambulance, and they took her to emergency. They gave her an aspirin along the way, and they couldn't find anything wrong. But at the end of this process, she was sent a bill for $9,000, which she had no possible way of paying. And I'm just curious, Margaret, Mimi has said that the healthcare in China was very affordable. Why in the United States is healthcare so extraordinarily expensive?
That's a big question. And Mimi, I had so many thoughts when I was listening to you and watching you about, what a healthcare system could be. The United States doesn't actually have a cohesive or coherent healthcare system. We have a very fragmented system, and our system is largely privatized, which is unusual compared to most of the wealthy nations have universal healthcare systems that are primarily publicly financed healthcare systems. Ours is, we have some programs for people who are in poverty, some programs for the elderly, but most people have to get private health insurance to get their care. And there's a severe lack of transparency in our system. So most people, when they go to the hospital or go to see the doctor, have no idea what the cost is going to be. And so like your friend KJ, people can be very surprised, even people with health insurance. It's interesting because the United States the biggest driver of personal bankruptcy is medical illness. People often have their health insurance tied to their employment. So if you become ill and you can't work, you lose your insurance at the time when you need it the most. But the health insurance companies themselves negotiate different rates with different facilities, and there's no real transparency about it. In addition to that, you have to go to a place that's considered in your insurance company network. So say you have an emergency when you're out and somebody calls an ambulance and you're taken to a hospital. If that hospital is not in your network, then that won't be covered. That care will not be covered. Some people can go to a hospital thinking, oh, this one's in my network, show up to the emergency room and find out that the emergency room is actually staffed by a private contractor, which may not be in their network. So then again, they're stuck with the entire bill for that. So for this reason, in the United States, we have people who either delay getting the care that they need, or they just don't even go at all because they're afraid of the cost. We have people who become ill here who have to make choices between getting the treatment they need, or maybe they choose not to because they're worried they won't be able to send their children to college. They won't be able to stay in their home. I have so many horror stories of things that people have done, including unfortunately committing suicide when they have a serious illness so that they don't bankrupt their family. So that's the reality of healthcare in the United States. And then you were also talking about how the physician spent time with you and asked you questions. And that was one of the things that really drove me out of practicing in the United States, is that I was being pushed to see more and more patients, spend, less and less time with them. And if they had more than one complaint, I was only supposed to address one complaint per visit. So having that ability to have a conversation and really find out more about my patient and what their fears and concerns were, we just didn't have the privilege of doing that here in the United States.
And, Margaret, we know that a large part of medicine is that bedside manner, that relationship building, and to be forced to remove that from your work and to work purely as perhaps an assembly line worker strikes me as a travesty of medical ethics, if you will.
It is, and our whole healthcare system in the United States is really degrading to the healthcare profession. Not only are you not allowed to, spend the time that you need with your patients to develop that trust that we know is so important, that rapport, especially for me as a pediatrician, getting to know my families and understand the dynamics within the family to make the children feel comfortable with me. You need time to do that, but also the way that the system works is if your patient needs a test, if they need a procedure, if they need a medication, we have to get authorization for that from the insurance company. And what really struck me when I first went into practice was that the insurance companies are not making their decisions based on what's best for the patient. They really are working to try to deny as much care as possible, because the way that they make money is by collecting money through the premiums that people pay and then denying and restricting care or shifting the cost onto the patients as much as they can. So I would talk to someone, an administrator, and say, well, this is what our standard care is. We need this many days. We need this medication. And then they would deny it, and putting me in a difficult position, putting all doctors. I mean, the burnout of physicians in the United States is very high, especially for primary care physicians, because primary care really is about having the time to develop those relationships. And I have colleagues who've actually been dropped by insurance companies because they were providing too much care for their patients. They were, prescribing the appropriate things, and more that the risk of care is being shifted onto physicians. So you are now paid for how well your patients do. But all of these factors that influence how well they do, their ability to afford the medication, their ability to do the things in their life that they need to do to support their health, these are out of our control and are not as our way of life in the United States, whether it be time for exercise, relaxation, healthy food, all of these things that we need to stay healthy, we don't have, great access to here in the United States.
Margaret, I think that's a really, really important point that medicine and health is actually a continuum. It's not just simply medical intervention, but it's an entire panoply of material conditions that we need in order to remain healthy. And I think what's striking in China is that this medical health insurance system, they have a basic medical insurance system which covers 95% of all people. And then there's also employer-related medical health insurance, which covers even more. And all of this is embedded inside, for example, in the targeted poverty alleviation program as what they refer to as one income, two assurances, three guarantees. That is to say, they want to make sure that everybody has income. The two assurances that everybody has food and clothing, because you can't be healthy without good food and without adequate clothing. And then the third three guarantees are basic medical care, safe housing, and education. So it's understood that healthcare exists inside a continuum of supports that are essential for human thriving. And I think that perhaps, Mimi, you can say more about that. But what has been your experience of China in general and how it supports its citizens?
I mean, I really loved what you said about how health is not just about medical treatment, right? And so I think what China and what the CPC has always been really good at doing is identifying problems from the root. In contrast to the US, especially in my time living there, a lot of problems and issues that occur that are very urgent, they maybe just slap some money onto it, or they bring a police officer or the military into it. It's very, very, very short term, not even solutions really. But in China, the most impressive thing is seeing the solution from the root. And one of those things, specifically about health and specifically about, physical care and maintaining a sustainable, healthy lifestyle, is also the bringing in of many kinds of sports, right? The encouragement of people to take part in sports. So, right by my house, there is a sports center, and this is a public state-owned sports center where you could rent a court or you could go swimming, and it costs about $1 for a session or something ridiculous like that. Extremely low prices that obviously encourage the public to participate in exercises, to participate in physical health, and also to do that in a social environment. I think that is incredibly important. I also think in the US, in terms of health management, eating well was quite out of the question for me because healthy food is so expensive, and exercise or gym facilities that are all privately owned was also extremely expensive for a membership. Whereas China has these public health and sports facilities where they not only allow you to do an array of sports with all the facilities there. There are actually some that are under bridges. I've been to so many along piers, like in really beautiful settings where there is any kind of free space. They will put basketball courts, rock climbing, all of this either for free or for extremely cheap prices. Not only that, but they also have health centers that are not, I guess, technically hospitals, but it's where you can measure your blood pressure or you can check your, I don't know, like all these kinds of things that you can find out for yourself as well. So there's so much public assistance and so much government funded assistance that allows you to not only get healthcare when you need it, but maintain a healthy lifestyle. So it is a from the root, long-term, sustainable solution for any kind of health crisis that could happen in China. And I think the US has a lot to learn from that, and I have learned a lot from it as well, because all around me, just seeing not only young people, but elders, that is the most important thing that I've seen. Elders and children being encouraged to participate in social activity, sports, all the kind of gym equipment that is for free, all the kind of activities and classes that are for free is incredible. And I think it creates a society where health is encouraged and health is beneficial not only to the individual, but for everybody.
Would it be fair to say, Mimi, that health is considered a human right in China?
1,000,000%. I would absolutely agree. Yes.
Great. And Margaret, how would you conceive of the U.S. System in terms of seeing health and health rights? Would you characterize it as, I mean, we live in a system that is largely focused on negative rights rather than positive rights that allow us to thrive.
Yeah, I mean, it's even I've spoken to colleagues I know who work in ethics and rights, and they don't even understand the concept of positive rights. They think of them as negative, focus on negative rights. Healthcare in the United States is absolutely not a human right. It's not even considered a public good. If you wanted to just be as basic as that and say, okay, we know that to have a functioning society, a productive society, we need to have a healthy society. We don't even treat it that way. And if you think about how to characterize a society, you can look at the most vulnerable populations and, determine, how well a society is functioning based on that. In the United States, we don't guarantee care during pregnancy. We have the highest rates of maternal mortality, so mothers dying in childbirth. We have rates of infant mortality that vary geographically in the United States, but some areas of the United States, there's very similar to what you would find in a lesser developed country because people don't have access to timely care. We also have a lot of racism baked into our healthcare system. It's part of the protocols. Unfortunately, this has been a long term, since the beginning of the founding of our country. And so that creates tremendous disparities in health outcomes in the United States. What's interesting is that we actually have within our healthcare, a purely socialized system. That would be our Veterans Health Administration, although that's changing. It's been moving more and more towards being defunded and privatized, as so much of our public goods are in the US. But there have been studies looking at health outcomes in the veterans population in the US where everybody's treated equally, everybody has the same access to care, and you don't see the health disparities that we see outside of that socialized system. So ours is very much about you can get health care in the United States if you can afford it. But even the model that we use pushes our hospitals to understaff, undersupply, overwork. And so even if you go into the hospital here in the US, it's important to have someone who's on the outside, that a friend or a family member advocating for you to make sure that you're getting the care you need, because you can't be guaranteed that you're going to get what you need even when you're in the hospital.
And that is a very pernicious model. I mean, just this idea that you can be a rational consumer advocating for yourself when you are actually sick and disabled already points out that there's a deep contradiction in the system.
Absolutely. I've, had family members that were in the hospital, and when the, physician or nurses come in to check on the patient and I ask about something, they're not communicating with each other. They have no idea. And so that causes delays in patients getting the care they need, or maybe not even getting the things that they need. The staff in the hospitals are just way too overworked here in the US.
Yeah. Margaret, I wanted to come back to the idea of the cost, and perhaps Mimi, you can say more about this too. But one of the things that I noticed was that in China, medical debt is about 1.9% of the population. That is to say, just under 2% of the population have medical debt, whereas in the United States, it's more like 15%. And if you include credit card debt, which is where often medical debt is transferred to, about 40% of US households have some kind of medical debt. And so we're also looking at a severe crisis of affordability, which I think all of us are aware of. For me, the most striking example was, a colleague, I went to their house, I asked them if they had medical insurance. They said, no, I don't have any. And I said, what do you do? And similar to what you have said, Margaret, they said, well, let me show you my medical insurance. And they took me to their medicine cabinet, and they had a small bottle of aspirin. And they said, this is for small small problems. And then they had a large bottle of Tylenol. And I said, well, Tylenol, and this is for my big problems. And I said, well, Tylenol and aspirin are pretty similar. What's the difference? And the person said, the large bottle of Tylenol is so I can do myself in. That's my, secondary medical insurance. So, can you say something about that, about cost, about the choices that people have to make?
Right, right. So it's important to understand that in the United States, the health insurance and what we call the medical industrial complex is a huge profit maker. If you look at who is, which CEOs are making the most money, which industries are doing the best on the stock market, it's our health insurance and medical and pharmaceutical corporations. And so that's what the bottom line is for them. It's not about health. It's not about transparency or serving the public good or determining what's needed and trying to meet that need. There's no real planning for healthcare and health in the United States. So we spend per capita about twice as much on healthcare per year per person in the United States as the other wealthy Western nations do. And despite the fact that about 60% of our healthcare financing is actually public dollars, because actually now the top private health insurance corporations are getting most of their revenue through government contracts, through privatizing our public insurances, Medicare and Medicaid. So we are actually spending enough money in the United States to finance a fully public universal healthcare system, but we don't do that because we have such, money and politics and political donations to both political parties coming from this medical industrial complex. So in the United States, you're mandated to have health insurance, or else you can be charged a fine on your taxes. And that health insurance premium, you're going to be spending easily, more than $10,000 a year just on your health insurance premium. And then you have to pay a deductible. That means that you have to pay money up front out of pocket before that health insurance will actually kick in. And those deductibles can also be several $1,000s that you have to pay before you get the benefits of the health insurance. But again, like I said earlier, if you end up going somewhere that's out of your network, then that's not even covered at all. And talk about transparency. When we go to the websites for the different insurance companies and look at who's in their network, many times, most of the time, that information is actually inaccurate. And then we don't actually have a rational pricing system in the United States. It's a market-based system. So people and companies will charge as much as they can get away with. It was very interesting. In the first year after the Affordable Care Act passed in 2010, there was a provision that health insurance companies could not raise their premiums by more than 10% each year. So when we looked at how much they raised their premiums, it was 9.99%. They went right up to that level without going over it. Now, since then, they've been able to go above that, and we're seeing people having yearly double-digit increases in the cost of their health insurance premiums. So just being able to afford to see the doctor is a big driver in people making their health decisions. And what we see, what the studies show, there was a big RAND study on this, is that if individuals are forced to make a decision about whether they need to seek care or not, doesn't matter what your socioeconomic status is, what your level of education is, people are not equipped to make that type of a decision and are just as likely to forego necessary care as they are to forego care that might be considered less necessary.
Absolutely. I'm also reminded of people who, for example, have medicine but try to make it last as long as possible. So they're taking minimal doses or suboptimal doses, and then that also leads to long-term problems as well. But Mimi, I wanted you to say a little bit about affordability in China. How did that strike you?
Yeah, so Margaret, as you were speaking, I think the word transparency really stood out to me because one of the biggest things I noticed and that really impressed me when I was at the Chinese hospital was, like I said in the video, the list of the prices for any procedure, like you can name hundreds of procedures, they're all listed there, and all the prices are right there, transparent for the people to know what they should pay, what is covered, what they can expect. It's not just some surprise bill that KJ, like you said, can throw people into like complete crisis. It can throw people into panic because they simply cannot afford it. I've had friends who've told me ridiculous stories about how they can do something as simple as a urine test and it cost $10,000 in the bill that gets mailed to them a week later. You wouldn't expect these kind of prices because these prices are just simply unreasonable, but the shock and the surprise still happens to countless people in America. Whereas in China, again, the thing that I loved so much was just seeing the prices right there in front of you because it's actually a procedure and it's actually a service instead of just a business that's trying to take money out of its users. Um, Another thing that I started to think about actually was how a lot of the time the central government actually debates on keeping prices low. So specifically for medicine, there have been countless debates, and there are some viral videos online where there will be these ferocious debates between pharmaceutical companies and suppliers with government officials, and the government officials will say lower. Lower the price, lower the price, lower the price. The debate is actually to encourage that the prices maintain their low price so that people can afford them. And that actually has caused, some backlash from pharmaceutical company owners. They're saying, oh, how can I turn a profit if it's going to be this cheap? And the governments here say, well, it's medicine. It's supposed to be cheap. Like you said, KJ, it's a human right. Another thing that I thought of, a story that is quite heartwarming. There's a story that is going quite viral right now in China, and there was a high-speed rail that actually was stopped recently because there was an elderly passenger on board, who had blood in his vomit. And so he immediately told the officials on the train, and they said, okay, we'll figure this out by the next station. So they had health, professionals on the train who helped him out, and they decided to allow him to get the care that he needed. They called the ambulance, so the ambulance would be ready for him at the high-speed rail at the next station. The high-speed rail in China is one of the most efficient working networks and systems and transportation services. And so any delay affects a lot of people, right? But despite knowing all of that, they actually lost about 50,000 yuan in the short amount of time that they had to slightly delay just to ensure this elderly man was able to get the care that he needed and to make sure that he returned to good health. And they did make a huge loss on the, profits that they would on that day just by delaying. I think things were generally delayed about 30 minutes. But I think that just goes to show that the life of one person is way more important than the money that they can make from the as per usual schedule of the high-speed rail. And a lot of netizens in China are extremely moved by this story. They think it's beautiful. No Chinese passengers on that train complained. They knew exactly why it was important. They knew why it had to be done. So that was a really wonderful story that I heard recently that really moved me, and I think speaks volumes of the priority of care and health in China, the way that it is held to be affordable, to be accessible to folks, and that turning a profit is not the main priority like it is in the States.
So it sounds like it's really people focused and not profit focused.
Absolutely, which is just such a different environment for me to be in after 8 years in America.
And I would wonder if that also gives you a sense of freedom. I think it's hard to feel free if you're always worried that you might have some catastrophic bill that you cannot pay.
KJ, I could go on and on about the word freedom. I think because the US loves to throw the quote unquote democracy or freedom in our faces and constantly say that, the Chinese or the communists of China don't have freedom. There's no democracy here. I think it's very ironic that they're saying that while I'm here feeling the freest I've ever felt because I don't have to worry about if I sprain my ankle. You know what I mean? In the States, I actually had to watch every single step, had to keep looking over my shoulder because I could not afford a health emergency, which that in itself is stressful, right? But then the added stress factor of not being able to pay your surprise bill at the end of it all, especially if you're not employed with a high salary or if you're not a citizen in the country, is already extremely shocking to the nervous system. And yet, here, I think the way that I see freedom is, I think, like you said before, the three major things, right? It's healthcare, it's education, and it's a roof over your head. And those things make me feel the freest I've ever been, above any other bourgeois freedoms that might be spoken about in the US. So I feel the freest I've ever felt. And yeah, I highly encourage everybody to also come to China and see that freedom for themselves.
Um, Margaret, um, just coming back to this notion of working for the people, what Mimi was alluding to about these debates on keeping prices low, you can go online and see the negotiations between Chinese health administrators and pharmaceutical companies. And if you watch those, it's quite amazing how ferociously the government argues for the right of people to have affordable medicines. And it's, actually very moving to see how forcefully they try and negotiate the absolute best conditions for medical clients. But in the United States, we don't do that, do we?
No, and actually, I spent about a year and a half during the health reform process volunteering as a congressional fellow. So I was in Congress, almost daily when they were in session. And it was quite the opposite. It was the industries that were in there providing the language, providing, they're saying what they wanted. And when we went to these meetings that were supposed to be stakeholder meetings, where all the various people and constituents who are concerned about the healthcare system get together, it was always the health insurance corporations who spoke first, who laid out what their priorities were. And it felt like in the room, there were a lot of great ideas, but at the end of the day, the people were not listened to at all. It was the corporations who were writing the legislation. In fact, our whole health reform process was basically spearheaded by a former health insurance senior vice president. So, Liz Fowler, who was then hired to write the regulations after the bill had passed. But I think, to give folks an example of how backwards the healthcare system is in the United States. Simple things like monitoring blood pressure and providing medication to control blood pressure. People don't have access to that. But if you suffer a stroke because you've had high blood pressure, if you have kidney disease and need dialysis, then you can get Medicare or Medicaid, then you can get it paid for. So we're not keeping people healthy on the front end. But if you get so sick that you can't work, but you'll still be living in a poverty existence. But that's when the government will step in and say, okay, now we'll cover you.
Yeah. And so it sounds everything is focused on intervention, which generates profits for private companies rather than the necessary prevention and spectrum of care, which actually would be the ideal way of dealing with these types of issues.
Absolutely. I think the COVID-19 pandemic really brought to the forefront the dysfunction and cruelty of our healthcare system. I was, looking at what was happening in China and, building a hospital in a week, having, free testing, and it was, widely available, people being given what they needed if they needed to sequester in their homes. We didn't have that happening here. We had cities and hospitals and states fighting with each other to get the supplies that they needed. We had, the health departments did not have what they needed to educate people, to provide protection equipment, and to provide testing, and even to do the work of tracing contacts and alerting people to let them know they might have been exposed. We were severely understaffed, and you see that the outcomes, the number of deaths in the United States as a proportion of our population, that was just so high and so overwhelming. Whereas you look at China and see how low the numbers were there, it was really remarkable to see the difference between a centralized planned system and a very fragmented for-profit system.
I think we could spend all day talking about these issues, and perhaps we'll return to this on another show. But I want to thank you, Dr. Flowers and Mimi Zhu, for joining us today. Dr. Flowers, where can people go to see your work?
Thank you. If you go to popularresistance.org, that's our website. I have a weekly radio program as well, Clearing the Fog, and you can sign up for the free daily digest at the website to stay informed on movement news and analysis.
Thank you. And Mimi, where can people go to find your work?
You can see my personal experience videos in China about socialist construction all around me on my Instagram at Mimi Zhu. And also I work with an org called Wave Media, where you can find stories and experiences that are happening exactly in China as well.
Thank you very much. To be continued. Thank you, Dr. Flowers and Mimi.